A 78-year-old woman with reactive airway disease was admitted 1 week ago with the diagnosis of pneumonia. She has been on oxygen for the past 2 months and has a history of chronic back pain due to osteoporosis. She has been on antibiotics since admission and is alert, oriented, and responds appropriately to verbal stimuli. The patient routinely ambulates 3 to 4 times a day with a walker. The pulmonologist visits the patient every day.
Good morning, Mrs. Russell. How are you doing today?
Good morning, doctor. I'm doing okay, I guess. I've been having this terrible back pain, and I think it's because I've been laying in this bed so long.
Okay. I'm going to order you OxyContin 10 milligrams, and you may have 1 tablet every 6 hours, and that should relieve your pain. And I'll be back in the morning to check on you.
Okay, thank you.
Bye.
The patient has a history of confusion when giving Lortab for pain, but has responded well to Darvocet. The patient received her first dose of OxyContin as ordered at 11 a.m. She stated the medication relieved her pain each time she received it. The daughter came to visit the patient the next morning.
Mom, good morning.
Don't you good morning me. You got me in here with this, holding me against my will, and you got me in this room full of monkeys, and that one over there by the sink sticking his tongue out at me.
Mother, what are you talking about? Nurse, she is so confused. What is wrong with my mother?
Well, let me look in the chart and see if there's been any changes now.
Pulmonary-wise, the patient was improving and coming off antibiotics, and her oxygen was decreased 1 liter from yesterday. The last O2 saturation was 96%. Her hemoglobin and hematocrit were within normal range. White count 33,000, temperature 98.6, pulse 90, respirations 20, blood pressure 130/82. She was on steroids, but they were being tapered from IV to PO from every 8 hours to every 12 hours. The last medication change was the order for OxyContin.
Nurse, do you think it could be that medicine, that OxyContin that she's getting for her back?
No.
I'm going to
Don't you can't take away something that's helping me feel better.
Well, Mother, is it really hurting that bad?
The nurse gets an order to decrease the OxyContin from 10 milligrams to 5 milligrams. 24 hours later, there is still no change in the patient's sensorium. The daughter talks with the nurses and staff, but they do not listen to her. They state that it is normal for a patient who is 78 years of age to be confused. The patient continues to try to get out of bed and climb over the rails.
Okay, I'll get this for you. I'll get it for you. Okay. Okay.
What are you trying to do to me?
Okay.
See that monkeys over there?
Okay, Miss Russell.
He's
There's no monkeys
blocking
here.
the TV.
There's no monkeys
There's
here.
monkeys everywhere.
Oh, okay. Okay.
Mrs. Russell is now your patient. What would be your immediate concern for her? What action should you take? What report would you give to the doctor? What orders would you anticipate?